afternoon, everyone. My name is Dr. Angela Sue. I'm a board-certified physician in internal medicine and geriatrics practicing at Kaiser Permanente in Northern Virginia. I'm joined today by my incredible colleagues, Dr. Ijaz Shamim and Dr. Ella Ackerman, both of whom are board-certified neurologists who practice in the suburban Maryland region. So we're very privileged to be talking to you today about Alzheimer's disease. As you may know, November is Alzheimer's Awareness Month, but of course, as neurologists and geriatricians, Alzheimer's disease is a condition that we think about and see every day of the year. So to kick off with some brief introductions, again, I'm Dr. Angela Sue. I completed my internal medicine residency at Columbia University and my geriatrics fellowship at the University of California in San Francisco. I joined Kaiser about 8 years ago, initially just practicing primary care, but now I also am one of the 5 geriatricians who are seeing patients as a part of our memory care program here at Kaiser for the last couple of years. Dr. Shamim, do you want to tell us a little bit more about yourself?
Sure. My name is Ijaz Shamim. I did my residency at Georgetown and have been engaged in research ever since, as well as clinical care. So I'm the chief of neurology in DCSM and also the director of the Neuroscience Institute for us, and also involved in Mid-Atlantic Permanente Research Institute and hold a few academic positions in different medical schools locally. And I'm actually interested in dementias in general because they seem to run in my families. And so I do some research in neurodegenerative conditions in general.
Very impressive, thank you. And Dr. Ackerman, can you share some of your background?
My name is Ella Ackerman, and I trained at the University of Virginia for my medical school, and then I went to Penn State Hershey for my neurology residency, and then I did my fellowship in neurophysiology at Hahnemann in Philadelphia. I have become interested in the field of neurodegenerative disease throughout my training. Although I love all of the neurology, I do take particular interest in neurodegenerative disease because it unfortunately is an inevitable part of our lives. As we know now, at least 50% of population by age 85 are diagnosed with dementia. So if you want to be a neurologist or any type of doctor, you may need to at least somewhat know about neurodegenerative disease. So I'm very excited at participating in this talk.
Yeah, thank you so much. You know, I really like this panel because dementia is one of those medical problems that really overlaps our specialties. It's a neurodegenerative disease, as Dr. Ackerman said, which of course she and Dr. Shamim are expert in, but it's also what we consider geriatric syndrome, which puts it in my wheelhouse. And geriatric syndrome basically means that you have a condition common in older adults that's caused by kind of complex interactions of multiple medical factors that will interfere with someone's life. And dementia is one of the classic examples of those. So between the 3 of us, we have a lot of experience taking care of people with Alzheimer's disease. And during the next 40 minutes or so, we wanted to talk about some of the most frequently asked questions we get from our patients regarding this condition. But we'd also love to hear from you if you have additional questions that you'd like us to address. So if you're watching live with us, please post any questions you have in the comments on Facebook, okay? So let's get started. And the first question I wanted to start with is something I get asked by almost all of my patients, and that is, what is the difference between Alzheimer's disease and dementia? And I think it's a great question and very important to make the distinction because the terms are often used interchangeably when really they're not quite the same thing. So to set the groundwork, I want to define the term dementia a little bit, and it's basically, a clinical condition that's present if you have cognitive decline that is so significant it's affecting someone's ability to function, your ability to do things. And that's simplified a little bit, but that's basically how we think of it. And when we say function, we're usually assessing someone's ability to perform activities of daily living like driving or paying your bills or cooking or taking your medications. So you can see that the definition is quite general, but hopefully you can start to imagine that anything that damages the brain really enough can lead to dementia. So, some causes of dementia that might be easy to think about in this way would be, a football player who's had too many concussions and gets dementia later in life, or someone who's had a lot of strokes, or someone who drank too much alcohol, right? But far and away, the most common cause of dementia, as we've been getting to is Alzheimer's disease, and that's probably present in about 60 to 80% of people with dementia. So while it's not the same thing as dementia, Alzheimer's disease is the most common cause of dementia and is probably present in most people who have the condition. So Dr. Ackerman, can you tell us a little bit more about what Alzheimer's disease is exactly and how it leads to dementia?
So in general, dementia types from specific definition are defined based on their pathology. Things we see under microscope in the brain of a person who has passed away with a particular dementia. Specifically in Alzheimer's disease, we see accumulation of two separate proteins. There is a beta amyloid protein, and the other protein is called tau. Beta amyloid protein is accumulated outside of the cells in the brains of people with Alzheimer's disease, and the tau protein is seen inside the cells of the brains of people with Alzheimer's disease. The mechanism for this accumulation is thought to be poor recycling mechanisms in the brain that happen to worsen in their efficiency with aging. But what exactly are those recycling mechanisms? And what type of recycling mechanisms are affected? That is a big what and why and question mark. And this is what we still do not know.
Now, one of the questions I usually get from the family members who I see with the patients is, if my parents or that I'm here with or my loved one has dementia, what does this mean for me? Am I going to get dementia because they have it? Is this hereditary? What do you usually tell your patients about that?
Well, thankfully, Alzheimer's disease is polygenic in its majority of cases, meaning most of Alzheimer's cases are non-hereditary. There are very few cases of Alzheimer's that are hereditary. And in fact, usually the onset of symptoms in those cases is in much younger age than usual, usually late 30s or even 40s. That's when we may see the beginnings of symptoms of Alzheimer's in hereditary cases. But the vast majority of Alzheimer's cases are non-hereditary, or we call them polygenic. There are multiple different aspects of genetics and lifestyle and other things that we are exposed to in our life that may play a role in the development of Alzheimer's in vast majority of cases.
So interesting. So really common, but not hereditary in the way you think of like blue eyes or blonde hair or something like that.
Correct.
Now, Dr. Shamim, we're talking about dementia here, but we also mentioned as we get older, our memory probably changes as well, just from normal aging. Can you talk a little bit about maybe what some warning signs of Alzheimer's disease might be and how you might distinguish them from just normal aging?
Sure. One of the things you have to remember, again, like you said, dementia is an umbrella term, and the most common cause is Alzheimer's. You can also have dementias related to strokes. You can have dementias related to other neurodegenerative conditions, including if your blood sugars aren't in great control, if your thyroid is not working well, if you have other infections and things like that. So you want to make sure that those things are addressed before we start going down the process of the route of dementia. Dementia, like you said, what are the classical signs? A lot of people many years ago, we used to say, if you forgot where you parked your car, then you must have the early symptoms of dementia. If that was the case, I would have had dementia by now, because I've been forgetting where I parked my car for the last 10 years. But in reality, it is not just being forgetful. It is actually being forgetful to the extent that you can't function in your daily activities. And so if you are a lot of people who have good insight that they are forgetful, they usually don't have dementia. It's usually the individual doesn't have the insight and they feel that they're fine. their kids come with them and they're banging their head against the wall that she can't remember anything. That's when we start thinking about dementia. Now, the key is that, even though these might be early signs of dementia, one of the things you can do is, if you are drinking a lot of alcohol, cut down the alcohol, because that does damage your brain. If you are smoking, well, cut down on the smoking. That might prevent you from developing dementias and stroke-related dementias early on. If you're not active and sedentary, being active, I tell my patients, it's like, getting blood flowing to the brain. And that helps your brain to get better. So regular exercising and staying physically and mentally active are very important. Some of our former presidents that are alive now, they all do crossword puzzles every day to keep their mind active. So, those are things you want to do. And, if you feel that you have early signs of memory issues and stuff like that, then you really want to make sure that you do exercise your brain just like you would your body.
Thank you. And I mean, I think that's true, in some of the early stages, honestly, it can be hard to know, right? Like whether there is a condition like dementia that's going to worsen over time. And part of the evaluation might be kind of monitoring the symptoms and the progression before we can really make a final diagnosis. So it's definitely something to kind of be cognizant of. But, if you're worried about your memory, like Dr. Shamim said, you want to make sure that you're ruling out other medical conditions that could cause memory problems. So the first stop you should be making is to your primary care doctor's office to make sure your thyroid's okay, your vitamin levels are okay. Do you have sleep apnea? Are you depressed? Are you having other risk factors for vascular disease that need to be addressed? Because as he said, even if you don't have dementia, these problems, if uncontrolled, can lead to increased risk of memory problems, but also general health problems later. So, it's very important to make sure that all the medical issues are optimized and addressed if you're worried about your memory and you'd like to keep it from getting worse. After your doctor has kind of ruled out any immediate medical issues, the good news is that unless the symptoms of the memory are atypical or declining really rapidly, then you have a little bit more time to figure it all out. And you might get a referral to talk to one of us, a geriatrician or a neurologist for further evaluation to kind of see if we can do any testing that can lead to a more definitive diagnosis to get us more information. And maybe talk about treatment a little bit too. One of the scariest things about dementia that a lot of people already know is that there's no cure. So Dr. Ackerman, when in the setting of not having a cure for Alzheimer's disease and other dementias right now, once someone's diagnosed, like what treatment options do we have available, and what do we tell them to keep their memory from getting worse?
Well, I tell my patients that one of the most important thing once you have the diagnosis is to set up your caregiving system. I think that determines quality of life and the prognosis in dementia of any type, including Alzheimer's, more than any other aspect of the illness or available treatments. If there is a good, solid, trustful, and loving caregiver setup, it has been shown to maximize the quality of life of patients with dementia and prolong their life for as long as possible with least amount of potential injuries or disabilities acquired on the way, or other comorbidities acquired on the way, such as falls, breaking hips, infections, and so on, hospitalizations, and so on and so forth. So that is the first on my list to address when someone is diagnosed with dementia, is their caregiving setup. Once that has been in place, and only after that do I feel comfortable discussing medications that are available. And those medications I explain to folks is they are symptomatic medications. They are in no way curative, preventative. There has been no proof that these medications prevent progression of dementia or reverse dementia. in any way. I explained that these medications, they simply change chemical balance in the brains of people with dementias, or specifically Alzheimer's, in a way that allows for more efficient communication of those brain cells and connections that are still there. That milieu, that balance of chemicals changes in such a way that ends up helping some, but not all people with specific dementias or Alzheimer's. Why do I address that as a second point? Because if a person has dementia and they don't have a good caregiving setup, are we even sure they're taking their current medications? It's difficult for them to learn any new processes or any new routines because of dementia. So if we're going to introduce a new medication into their routine, is it even going to be taken on as a routine? Are they going to analyze the effect of the medicine on their bodies and on their mind? That would be a very difficult task for them to do on their own. So the caregiving is first. Once that's in place, then we discuss the medication and their role. We discuss side effects, we discuss the benefits, and then we make a decision. Is that a good choice for that particular person or not? If you want me to specifically discuss specific medications, I certainly can. I can briefly touch on those too.
Well, I think those are all things we usually approach on an individual basis, right? Depending on what the symptoms are, there are other medical problems, cardiac conditions, things like that before we decide. But, as you said, there's a couple of classes of medications that we will use to kind of boost the brain chemicals in a certain way with the goal of maintaining function, But as you said, I also really emphasize that even while taking the medications, we expect that the memory will get worse. But hopefully the reason to start is to hope to maintain your function a little bit longer, which is definitely helpful when you're living in the community. What about other like non-prescription medications? Even just this morning, I had a patient ask about Prevagen and whether he should take it for his memory and, whether there are other supplements they can take. Like, do you have any recommendations around those non-prescription things that people can take?
As you explained earlier, prior to diagnosis of dementia, there is full workup, including blood work for various vitamin levels and such. So if that workup showed that someone is deficient of vitamin B12, for example, then certainly they would benefit from supplementation of B12 vitamin. But specifically, supplements that are advertised as being miracle solution to dementia. Unfortunately, there haven't been any randomized controlled trials to support the efficacy of those supplements. So I do not personally recommend any specific supplements outside of known medical related deficiencies that we identify as part of workup for dementia.
Got it. Thank you. One other medication that actually was...
One comment on that. It's also important to remember that supplements are not regulated by the FDA.
Correct.
And you don't know what's really inside of them. And sometimes we've known from the past that chemicals that are in those supplements can be harmful. So you have to be very careful. So Dr. Ackerman is right. It's always best to use medications that are FDA approved.
I agree, especially if you're taking a lot of other medications or blood thinners or things where levels are very important. You have to be very careful with supplements in general. But speaking of FDA approval, there was a medication you might have heard of, Adukanemab, that was approved by the FDA for Alzheimer's disease earlier this year. And when it came out, I got a lot of messages and calls from my patients. I'm sure all of you guys did too. But it doesn't seem to really turn out to be the treatment we were hoping for. I mean, Dr. Shamim, can you tell us a little bit more about Adukanemab and its role in dementia treatment right now, and maybe also any other research or therapeutics we might look forward to if this is not the one we want?
Sure. So like Dr. Ackerman mentioned earlier, the main culprit we think, or at least we postulated for years, was that you have these proteins that are accumulated that don't recycle. But now we're finding out that that's not the only pathology that leads to dementia. There's probably a whole slew of things. that we don't fully understand. And I think that a lot of the newer drugs are coming into play in addressing those things rather than just the protein aggregation that occurs in your brain. The medication, the new medicine that came out, which I have to say does not look like it's very good. And I think it has borne out that it really isn't very good. And I think it was even known before that it wasn't very good, but I think there were certain forces that wanted it to be approved, and I think it was approved. And I don't prescribe these medications personally because the data actually doesn't suggest any clinical improvement. So like Dr. Ackerman was explaining earlier, there are these proteins that accumulate in your brain, and they are toxic and they cause you to have problems with cognition. These medications actually can decrease the production of those proteins. But what that has never been shown is that it actually improves your cognitive status. So yes, we can decrease those. So it's a great step forward. Now we have to be able to figure out medications that will not only help with that, but maybe address the other things that may be causing the dementia, and make it so, and to really study if it actually has any meaningful benefit in the patient rather than just the proteins in the brain. There are other medicines that will most likely be coming down the pathway in the next few years that are going to be tried. And I think most of this work is actually done in Europe and less so in the United States. And I think we'll benefit from their expertise as we bring newer medications to trial. And I suspect we'll have something in the next decade or so that will actually prove to be of some benefit. And these medications do have some, this new class of monoclonal antibodies that we call these medications do have some significant side effects that you have to be careful of, like inflammation in the brain and things like that. So you have to be very careful how to use them. We don't want to cause problems rather than help the person.
Definitely. Well, I know we're all anxiously awaiting these advances, for the medical treatment of dementia. Hopefully, as you say, not in the too distant future. So, I mean, in the meantime, how do you usually, Dr. Shamim, I guess, talk to patients about what they should expect in terms of how the disease will progress? A lot of people ask about what stage they're in. What do you usually tell patients about this?
So remember, neurodegenerative conditions, they're called neurodegenerative because they are progressive. They will always progressively get worse. And that's the one thing you have to understand. The only thing, and a lot of times the patients are ambivalent to this progression, but the family is not. The family is the one taking care of the individual. A lot of times I talk to the family members and I talk to them and I tell them, there's little that we do for the patient in these cases, especially as they're progressing through the advanced phases of dementia. A lot of it is for the family to give them support, to fill out their forms so they can take care of the individuals for their work-related matters. If they need some help at home and they need prescriptions for that, we're happy to help them. And the aim is that it's not just the individual who's suffering from dementia that needs to be taken care of, but the people around them. And it is known that one person with dementia really, it takes about good 4 to 5 people to really take care of that individual well. And then they need a lot of support. We have certain medications that may help slow the progression a little bit, but they don't really work that well, just like Dr. Ackerman said. And they do cause side effects. And we do treat symptomatically. A lot of times people with dementia have a lot of behavioral problems. And we can use certain medications. And again, any medicine we give will have side effects. So I talk to them about this. And I talk to the patient's family that, you want to keep everything very regimented, keeping things the same regularly. So taking a shower at the same time, eating at the same time. A lot of people stop eating, and part of the reason is because they have this decrease in sense of taste and smell as they get older, and they need more flavorful foods, and that's why a lot of older people eat saltier and sweeter foods. And when they're progressing through dementia, I always tell them, give them what they need because otherwise they won't eat. And then they'll have what we call failure to thrive and become very emaciated and even harder to take care of, and quality of life will really suffer. And it's always a good idea to make sure you have people that are taking care of the power of attorneys early on and advance directives. So you're not stuck with that at the end of, towards the end of the dementia, because then you need to get guardianship from the court and things like that.
Thank you. Yeah, I mean, I think it's always interesting to me how variable the disease and the experience can be between people and families. You know, as you were saying, we don't know everything about the disease process. And so, you know, just clinically even, you know, some people will have the steady decline over years that we think of classically as how we think Alzheimer's is going to progress. And some people get more forgetful, but might maintain their function for a long time, you know, and really, I think the experience, as you said, of a person, their family taking care of a dementia patient is really depends on how they're manifesting. Someone who's forgetful but agreeable is going to cause a lot less difficulty for the family than someone who gets agitated or isn't sleeping or is refusing to take medications or showering. And these are the ones that really struggle and have a lot of the caregiver stress and burden. And, you know, one of the things that is helpful is to know that usually these difficult behaviors also come and go in phases, but it can be very difficult in the moment. And I know that we in the memory care program, and you guys as well, probably do spend a lot of time, as you say, with supporting the caregiver around these particular challenges. Because even though we can't fix the disease itself, you know, if we can troubleshoot those individual pain points that are really impacting everyone's quality of life, you know, we can make a big difference in how the patient and their family are experiencing this all. Dr. Ackerman, do you see in your practice some other like big challenges for caregivers, and how do you help them manage all this stress?
Certainly, certainly. There is a lot of resentment usually that builds between the primary caregiver and the person with dementia, person with Alzheimer's. That's where you see most conflicts usually arise. It's not from the secondary caregiver or even tertiary caregiver. It's the person that's there all the time. And part of it is, of course, is enormous caregiver stress that the primary caregiver is facing usually that they're sleep deprived, usually they're frustrated, usually they're lacking help, usually they're just not relaxing enough and able just to, you know, deal with all the stressors of having to face the same problem from day in to day out. And one of the most challenging things is to kind of give them the sense of empowerment first. And usually when the primary caregiver comes to me, the first question I ask, when was the last time you had a day off from caregiving, or at least half a day off, you know? And then I get a sense, oh, is this the challenge that they're facing truly day in and day out, or is that something that they just overwhelmed with because they were overwhelmed with everything at this point? But some of the most common, of course, behavioral challenges are sundowning, right? This is the behavior that changes in the second half of the day in a person with dementia, or specifically Alzheimer's, and how to deal with that. You know, it's change in behavior. Usually confusion sets in more during that time, more of anxiety type of behavior, more of agitation type of behavior, more of restlessness type of behavior.
Right?
Sorry.
Or neediness sometimes.
Neediness, absolutely. Paranoia. Many times that's when the hallucinations come. That's when the person may act more unpredictably and erratically. And, you know, I have read a lot about how to deal with this behavior, but I have to tell you, becoming a mother has taught me more about how to deal with this behavior than anything I've read. And but I'll start with what I have learned before then. So what is specifically recommended is to make sure that the person with dementia, with Alzheimer's, has frequent breaks throughout the day so that they are not so fatigued and so exhausted by the afternoon that they're so decompensated that they can no longer function effectively. And that is what makes them act this way, basically. That's the theory. All right. So that's the number one. Number two is just regular schedule throughout the day in terms of their brain understanding that this is daytime and this is nighttime, and I eat at this time and I rest at that time, so that they have a better way and smoother way of transitioning from daytime to nighttime naturally. Uh, and in general, if they are in fact more tired by the end of the day, which is of course expected because their brain works so much harder than an average brain during the whole day, to decompensate a little bit earlier during the day than an average person's brain, you want to maybe shift their dinner time a little bit sooner and shift their bedtime a little bit sooner. Maybe think of some more relaxing activities, maybe think of some more pleasant activities with less noise, less stimulation closer to the end of the day, that will allow them to make that smoother transition into the nighttime, which will allow for less of this sundowning behavior. And then I became a mother. And then I observed my children and I realized they also have sundowning behavior. And that's when I realized, I can connect with my caregivers better if I talk to them on the level of, have you ever been a parent? Have you ever taken care of a small child and made sure that they were not fussy before they went to bed? What were your strategies? How did you do it? What worked? And I said, you never communicate with a person with dementia like with a child, because they're not a child, they're an adult. But the strategies you implement as a parent are very similar to the strategies you may implement as a caregiver of a person with dementia that may be very helpful. So I see a lot of parallels.
Yeah.
I see a lot of parallels. Yes.
And I guess similar to that too is, it takes a village to raise a child, right? And just like Dr. Shamim said, to do it on your own and being a primary caregiver for dementia, person with dementia is a lot, right? And so having that support, whether it is some respite, having someone come to let you go out for a few hours a week, or having a day program that your loved one can go to so you get a break and they get some stimulation, having family take turns, all of these care systems that you talked about before are so important, because, caregiver fatigue and exhaustion is real. And, I think that sleep disturbances are one of probably the most common behaviors that lead to someone having to go into a nursing home or other institution because the family cannot manage when they can't sleep, right? And so it's a practical and physical and logistical hurdle that all of these caregiving families are dealing with. So yeah, so many things. And I think each one of these behaviors and the sundowning and all of them, like, you have to kind of think through what's causing it and, try to understand it more. And, that education, as you said, is so important, kind of like flipping your mindset and kind of looking at it through a different lens as well. So caregiver education is huge, because the more you understand what's going on and know what to expect, I think the better you cope with it too. Just like, when you have a new child that you don't know how to take care of, right? So there's the Alzheimer's Association, there's books, there's support groups, your local community office on aging might have resources, but these are all things that I encourage my families to pursue, because the more you know, the better off you'll be. Of course, the barrier I hear a lot is like, well, I don't have time to go to a support group, I don't have time to read the book, but we have to do the best we can, because long term, that's what's going to help the most,
And to mention the I don't have time, as a new mom, you would purchase a book like What to Expect First Year or How to Take Care of a Toddler. Most moms don't have time to read these books, but you do have time to look up information as needed. And that, I think, is what's wonderful about Alzheimer's Association of America website, is that you can go there for a specific piece of information and look up that one piece and just read that one little excerpt, that one little paragraph. And that would already be enough to give you some comfort of, aha, that's somewhere where I can start.
Excellent.
One of the things you have to remember is that, Dr. Ackerman has a very good point about, they become childlike. The good thing with children is they do grow up. And unfortunately, the people with dementia tend to go the other way. They regress. So, where as a parent, you would hope, and you see the light at the end of the tunnel. For a caregiver, you don't see that light at the end of the tunnel, and it becomes very frustrating. To help people walk that walk is very difficult, and that's where we come into play. And we have to be so cognizant of the caregiver burden and the caregiver burnouts that occur, because that not only diminishes care for the individual who's suffering, but also for the people around them.
Absolutely. So we're surprisingly getting to the end of our time here, but there were a couple of questions from the Facebook community that I wanted to maybe clarify. We started touching on this a little bit, Dr. Shamim, but it sounds like people have more questions about kind of the first signs of dementia. There's someone who said, I've gone very forgetful and I'm losing things all the time. What does that mean? Or, my long-term memory is good, but my word retrieval is not so good. If I'm asked a question or about a name or a place, I can't bring it forward quickly. What does this mean? Should I be worried?
Yes, that's a very good point. And just like you said, if you're having some of these concerns, it's not a bad idea to discuss it with your primary care doctor, because they will try to look for other causes, those causes that are actually treatable before you start going down the route of getting diagnosed as dementia. But you are right in that the long-term memory doesn't get affected first. It's the short-term memory, which is what she's complaining of. So that is a sign of condition that may be dementia. Now, it's also the case that many times if you have too much going on and you can't focus on things, if you have a lot of stress, if you're not sleeping well, if you have psychological issues, those things also play a role in not focusing on things that you need to focus on. It may look like you're having problems with short-term memory, but in reality, it's the other stuff that we can actually fix. So if you're not sleeping well, that's the first thing. Sleep is being implicated in a lot of different things now, including developing dementias down the road. So sleeping well is a great idea. Keeping a good life balance where you're exercising regularly, you're keeping your mind active, and you are sleeping well is very important.
And I think in the pandemic, a lot of us have been under all of this chronic stress, and I know it's happened to me too. And, you might not even perceive that you're stressed or, that what's going on in the world might be affecting how you're functioning and how you're thinking, but I think it absolutely can. Think about all the things your brain has to juggle and tune out and tune into every day. Our brains are amazing. They can do all this stuff, but certainly this kind of chronic stress everyone's been under, if your memory problems have just occurred in the pandemic, I've seen a lot of people where most of it can be attributed to changes in work and social interactions and financial stressors and all those things. So I think, as Dr. Shameen said, the right answer is always to check in with your primary care doctor about it. But so many things, not just dementia and neurodegeneration, can cause problems with how your brain is functioning and thinking.
Dr. Shu, you bring up a very good point. One of them is that there were some studies done during the pandemic that there was a very high incidence or increase in rates of people complaining of nightmares. And they didn't correlate that with being anxious, but the studies did suggest that the rates of nightmares did go up in a lot of individuals, suggesting that there was a lot of issues with anxiety, stress, and really being socially separated from other people, especially the older people. And we're actually seeing that those patients who had dementias actually progressed a little bit more because they were so isolated.
Yeah, the opposite of what we recommend.
Social interaction. What's that?
It's the opposite of what we recommend. We say be engaged and social, right?
And social isolation in the current, everybody said social distancing. I always said, not social distancing. You need to physically distance and be socially active. And we have so many ways of being socially active now with the internet, and like we're doing this meeting, we could be, you could be interacting with a lot of other people while keeping your physical distance.
Yeah. And I think we're entering a new phase of the pandemic now, right? We're talking about living with this disease forever. And I know a lot of my patients are still really scared. And even though they're vaccinated, they're boosted, they still don't really want to go out and see people. It's just, it's been such a change in routine in life for them. And I really try to push those people to get out there a little bit, because even if you're older and technically at risk for, complications from COVID, I feel like the risk of isolation and lack of stimulation might even be more at this point, once everyone's been vaccinated and the pandemic is getting better. So it's something to definitely think about if you have a loved one who's cautious, right? Definitely want to be cautious and safe, but balance that with the other risks and negatives involved with continuing the isolation. So we're almost at the end of the session, but really quick, because the holidays are coming up. I think there's no more questions. I was hoping we could just maybe give people some quick tips on how to optimize the holidays, for people who have had some dementia, dealing with patients, new family gatherings coming up. Any suggestions, Dr. Ackerman, on how to make this meaningful and safe for everyone?
A lot depends on the functionality of a person with dementia, especially in later stages of dementia. It's very important to keep in mind that a person can be easily overwhelmed by too much stimulation that they're not used to. For example, if they're used to be being only around 3, 4, maximum 5 people on regular basis, and then suddenly you have a big family gathering of 20 people, well, they may not be very happy. They may behave in a more anxious way. They may tire out easier. They may show some behavior you've never seen them show. And that may really scare you and make you want to bring them to the emergency room because you don't know what's going on. So to avoid such surprises, don't give them too many surprises. Keep things simple, steady. Invite amount of people that you feel they're not going to be overwhelmed by. Don't require them to attend for extended period of time, potentially, reduce maybe 1 or 2 hours max, and watch them closely. When you start seeing they're tiring out, time to take the person out and put them in their familiar, calm surrounding where they can relax and be in the quiet. It's better not to travel too far away. Also, for those folks,
Time difference.
yeah, and day trips are okay. Usually, it's the overnight trips for people with later stages of dementia that become an issue. Earlier dementia stages, when a person is basically independent with most of their activities, they just need a few reminders here and there. They usually do fine, but it's the later stages that become much more tricky to plan.
Great. Well, I think that's all the time we have for today. But I really enjoyed this conversation. Thank you guys so much for joining, and all of you out in Facebook Live, thank you for joining us as well. If you have any other questions, please do continue to put them in the chat. And I believe this session will be recorded if you want to watch it later or show it to some friends and family who might find it helpful. So have a great day, everyone. Enjoy your afternoon.
Thanks.